So let's get started with today's clinical topic. Our speaker today is Dr. Eric Block. He's a practicing general dentist in Acton, Massachusetts. He graduated from Nova Southeastern, and then he completed a 2-year implantology program at Boston University. And he's committed to helping dentists become more efficient, productive, and less stressed. What a great combination that is. He's a co-founder of the International Academy of Dental Life Coaches. And in 2023, he was selected as a wellness ambassador for the American Dental Association. He's also a fellow of the ICOI, the American Academy of Dental Sciences, and the International College of Dentists. His topic today is one that it's just so important to our health and happiness as practicing dentists. And I'm really happy to see these kinds of discussions occurring more and more, that much more frequently than they did in the past. So I'm delighted to turn this over to you, Dr. Eric Block. It is all yours.
All right, great. Thank you so much. I'm going to share my screen here, and then I'm going to go into slideshow mode. Let me know if everyone can see that.
That's great. Thank you.
Okay. Thanks for the kind introduction. And I'm going to just really today just share my story. And I'm going to talk about how I got more efficient, productive, less stressed. And I've been practicing 20 years, and I'm more re-energized than ever. We just recently, 1 week, it's been 1 week, we're fully out of network, and it's just been re-energizing for me again. But I'm just going to go over my story here. I'm a full-time practicing dentist, just outside of Boston, about 30 minutes west. And I'm a husband, father of 2 kids. We just got a little puppy. I'm the owner of Acton Dental Associates, which is a one practice, multi-specialty practice. We're very much part of the community. We live here. My kids go to school here, and it's been about 20 years. Now, I'm going to go back to when I first went to Tulane University, and I didn't think I was going to be a dentist. I actually applied to Tulane and went down to New Orleans, and thought I was going to be a business major and graduate with a business degree. And then I sat through microeconomics and macroeconomics and statistics, and I said, you know what, this is not for me. And I had to choose something. So I ended up choosing psychology as my major. But one night, like many college students tend to do, I was out at a bar and I just missed my mouth with a beer bottle, and I fractured my number 9 central incisor. And I walked around with half a tooth, and of course, I probably felt no pain that night. But the next day, I went to a local dentist in Metairie, Louisiana, just outside of New Orleans. And I just really liked the way they patched me up. They took care of me. I walked in all embarrassed, and I left with my smile back. And I said, you know what? Maybe dentistry is something I could do for a profession. And I actually took a year off after Tulane, and I taught tennis, and had to finish up with the prereqs. But I took the DATs, I applied and got into Nova Southeastern. I was actually the second class to graduate. This is back in 2002. And then in 2004, I finished with a 2-year implantology program at Boston University, where we just placed and restored implants and did surgeries. And it was such a great program, like a half pros, half perio program. And then everything was all peaches and cream, right? Well, not so much. I went through a tremendous amount of burnout about halfway through my career. And I actually just really regretted my decision in becoming a dentist. I, had major Sunday night blues. I dreaded going into the office on Monday morning. I couldn't wait until 5 o'clock so I could go home and decompress from the day. I couldn't wait till the weekend so I could decompress from the week. I couldn't wait until lunch so I could go home for an hour. And for sure, I couldn't wait until I retired so I wouldn't have to do this anymore. And I was really just avoiding people. I was avoiding patients. I wasn't going to social functions at the office. I would wait and monitor instead of treatment plan and treat. I was just miserable. And I finally said to myself, you know what? This is no way to live. And I had gotten myself so wrapped up with anxiety and afraid of getting sued, that I actually thought about going to law school and leaving dentistry because I wanted to flip the script and be the one doing the suing. That's how anxious I was about getting sued and getting a bad review or having an uncomfortable conversation with a patient. But as a psychology major, I knew I had to do something, and I'd always wanted to go through therapy. So I finally picked up the phone and I called a local therapist, and I went every 2 weeks, and we just dug into what made me tick and why I was so anxious. And it was all up here. It was just in my noggin. It was me putting too much pressure on myself and trying to be everything to everyone. And I had a major case of perfectionism. And when things didn't go right, I would beat myself up and I would focus on the one bad thing that happened during the day, like that crown didn't fit or that filling broke. And I didn't focus on the 30 good things that happened. Also, I'm more introverted. Even though I do webinars and podcasts, I'm naturally more introverted, I learned. And the social nature of the profession was just a grind for me. Going from room to room to room, and always being on and putting that happy face on for the patients. And it was really like acting. Inside I'd be thinking about the person that's crying in my chair that I just told their tooth had to be extracted. And yet I have to jump into the next room and be on my A game and be happy. Because no one wants a sad, tired dentist working on them. So doing this over and over and over again was really what was causing my burnout. Um, but I was able to overcome it. And I actually love going into work every day. It didn't happen overnight. It took a lot of time, a lot of changes, but I had a story. I felt like I had a story to tell and share. And I felt like if I could help, a few dentists out there, it was worth it. So I ended up starting the Stress Free Dentist brand with podcasts and my book and Facebook groups, and just to let all the dental professionals know that you're not alone. Even though you may be a solo practitioner, all of us dentists, we kind of live these parallel lives, and it's really important to share stories and engage with others and share our successes and failures. So one of the take-home messages today is very important, is that we're all different. I always say, you be you and me be me. This is my son. This is how he got around. He's now 8 year old. He's 8 years old, and this is when he was probably about 15 months. And he would do this butt scoot thing, and he would scoot around. He didn't crawl, and then he would just pop up and start walking. And that's how he got around. That was him being him. He just skipped the crawling. It worked for him. So I always tell dentists, what works for you, great. What works for me, I'm going to share some things that have worked for me over the years. And if they help you, great. But if not, go out there and find your own game plans and your own workflows. And that's really part of the stress-free mantra, is going into procedures with a game plan and a workflow. Because I used to not do this. I used to just go into procedures and I would wing it. I'd pick up a handpiece, I'd start drilling, I'd put the burr down, I'd pick up another burr, and it just caused a lot of voices in my head. Procedures would take longer. It was just me not having a good game plan. But now I do. I have a game plan and a workflow for every procedure I do. And I've found my game changers that have really helped me get more efficient, productive, and less stressed over the years. And I'm going to share some of those with you. Isolation device, for me, such a game changer. I couldn't practice without it now. I even use them for surgery. And it's, really helped me with my shoulder pain. I used to have tremendous amount of left shoulder pain, my retracting arm. Now I no longer have to wrestle with a big tongue or cheek or lip. And it also keeps the patient's mouth propped open. And now with this day and age of us being shorthanded with staff, which is a major issue in the industry, I can actually work alone a lot of times with the isolation device in. And if I'm shorthanded, I can have my assistant in the other room doing something productive. And I can actually work alone. But I even use it for implants. It's just been a great thing that I've added. Been a total game changer. The anesthesia plan. Now, I used to not have a plan. I would try to get patients numb, pick up a burr, I'd start drilling, and they'd jump in pain, and I'd jump, and everyone was stressed. No one was happy. But if you think about it, having a good solid anesthesia plan, it's the start of most procedures that we do. If you can't get a patient numb, then they're not going to be a happy camper. You're not going to be happy, and it's going to cause issues for that whole procedure. So I use what's called the endo-ice test, and I spray a cotton swab I don't use a Q-tip because it doesn't get as cold. I take a cotton, I pull with a hemostat from a cotton roll, a piece of cotton, and I douse it with endo-ice until it's crackling cold. And then I put it on any tooth I'm working on. And if they feel the ice, if they feel the cold, then I say, no passy the icy, no drilly. They have to pass that ice test before I drill. And now that I've used this, I've really, I haven't had an issue with patients jumping in pain during the procedure. So it's just more relaxing for them. It's more relaxing for me. Another great thing in my tool belt is intraosseous injections. Um, After, patients has all the signs of being numb, but they still feel that endo-ice. I'll go in with the intraosseous injection. Tuttle numb now is a great technique. And I just can't remember the last time I had to dismiss a patient because I couldn't get them numb. It had happened, several times, over my career. But it's just so great to have a plan for anesthesia. And if anyone has any questions about anything that I'm talking about, please feel free to throw them in the chat, or you can email me. I'm an open book, so about anything. So here's my kit that I use. I've created this. It's my own workflow. One row is for crowns, the top row. The bottom row here is for composite fillings. And I just go from burr to burr to burr to burr, and I don't skip steps. I go from A to B to C to D. It's like a recipe. It's a workflow. And each burr has a purpose. And it just puts my brain on autopilot. And I no longer have those voices in my head that are telling me to do this, do that. It's just go time. And it's because I've done these, hundreds of times, but it's a plan in my head. Implants take, a bit more planning. But when I go into a filling or a crown, I'll, evaluate the tooth, the x-ray, the situation, and then I'll formulate a plan in my head. So back-to-back class 2 composites is, a very common procedure in my general practice. They used to be stressful, especially lower molars. They would take a long time, and I would dread seeing them in my schedule. Now I don't even think about it. It's just another thing that I do, and it's 30 minutes. As you can see here in the upper right, there's my endo-ice test. I douse that little ball of from a cotton roll, and it's crackling cold. And if I put that on the tooth and they don't feel the ice, then I know they're numb. If they still feel it, and there's, you got to tell them that you're going to feel pressure, but if you feel cold, then you're not numb. And then I'll continue on with my anesthesia plan. But back-to-back composites now are no longer as time consuming or as stressful. And here's where I start. I always start with a 245 burr. And I always take this mid-procedure picture. I always want to show the patient the decay. And the nastier the picture looks, the better. Big dark or brown area. I'm going to snap a photo. I always have an intraoral camera by my side. I have it like a holster, like a lightsaber, ready to go at all times, because there's no situation where a patient will say to me that filling should never have been done. I will show them that picture, and they usually look at that picture and they say, wow, that's gross. Or thank you so much for taking care of this. They own the problem when you show them a picture like this. So intraoral pictures, mid-procedure pictures, total game changer. Here's my back-to-back class 2 composites. I'll use 2 bands, 1 wedge, and 1 ring. I'll do a lot of ball burnishing, and I'll burnish one side. I'll fill it. Then I'll burnish the other side. I'll fill it. And then I take everything off and I shape and polish. And this is taking me a half an hour. I'm getting very predictable contours and contacts. And it's just made doing back-to-back composites so much less stressful, efficient. Patients will say, wow, that was fast. But it's all because of a game plan. And my game plan may be different than yours, but the important thing is to go into every procedure with a plan. Here's another case. I'll finish one side, then I'll ball burnish. I'll make sure I have a good seal in my band. I don't want to be able to see the wedge. That way I know I have a good seal. And then I'll restore the other side. Again, one ring, one wedge, two bands, very predictable. And then here's my workflow of my burrs that I use to adjust the occlusion and shape and finish. Artificial intelligence, I'm using Overjet, and again, I can't remember, I can't believe that I didn't use it earlier. When you start to go with these next level treatments or techniques in dentistry, you look back and you're like, how did I practice without that? And that's how I feel about the X-ray diagnosis of artificial intelligence. And it's there as a help. It's such a great backup. It's great for showing the patient these big red areas. Explaining to a patient about a class 2 area of decay is not easy. So if you have something else to educate them with like this area of the red, you can outline exactly where the cavity is. It's such a great way to show the patient and get them to accept treatment. The other thing is that my eyes at 8 a.m. are more fresh than they are at 4 p.m. I may miss something, but the X-ray Overjet or other artificial intelligence softwares, they're there like a backup, like a friend to make sure you don't miss anything. And it also opens up the conversation with the hygienist about discussing if there's any pocketing or bone loss. So it's just been a great thing that we've added. And here's actually that case. Again, I cleaned out the old fillings. This patient did not want to do crowns. They just wanted to do fillings. So I love showing this picture to dentists because they'll say, you should have done a crown. Well, that's not the point of the picture. And we already had that discussion with the patient, and they just wanted to do fillings. So I document it, and we'll do crowns later on. But there's that mid-procedure picture. Again, the nastier the better. Show them those brown areas. There's the decay that the Overjet picked up, and I'll restore with my back-to-back workflow. 2 bands, 1 wedge, 1 ring, very predictable, and very easy contacts and contours. Crowns used to be a big deal for me. I've been practicing 20 years. So sure, as you get more experienced, everything gets a little bit easier, but I never had a real good plan. This is actually my workflow, which was Mike DeTola from Gladwell back in the day was inspiration for this workflow. But I do this pretty much every time. Every time I start with a round diamond and I go around the buccal and I make my margin. Then I go around to the palatal or lingual, and this is about a 2 millimeter burr, so I really sink that in there. And then I just sweep up. I sweep up on the buccal and I sweep up on the palatal or lingual, and my buccal and lingual margins are pretty much done. I'll go on to the next burr in my workflow, which is typically the 245, and I'll make my slices. So I'll make my interproximal slices, my occlusal depth cut slices, and then both interproximal slices. And then on to the next burr, which is the football diamond burr. I'll flatten the occlusal here. I always feel like, when you've made the tooth shorter, it's just easier to work on the tooth all the way around. So after I make my depth cuts, and then I'll shorten the tooth according to those depth cuts with the football diamond. And then I'll go in with this thin chamfer here, and I just go right through the enamel here and open up, and I want to see gum here. If I can see gum, then I know that I'll be able to get my cord in there and that I won't have an issue with the crown seating. And then the final burr that I use is the big diamond burr. Occasionally I use the small shorty burr if someone can't open that wide. But that's pretty much it. The big fat diamond, I'll finish my my prep. I'll pack cord where needed. Nova was a 1-cord school where they taught 1-cord technique. BU was a 2-cord technique school, and I typically use the 2-cord technique. And I just place cord where I need it. I used to think I had to put cord 360 degrees all the way around the tooth every time. But I only do it if I need to expose a margin or for moisture control. And sometimes I don't need a cord. If it's a super gingival prep, no cord needed. But I'll pack the cord in, I'll finish my prep, and then I know I have a good margin for my scans. Now, here was the old way. I had a temporary crown. I would treat the crown with the Ivoclean and then a primer and then cement. And when I cement a crown on, I also have a game plan. I used to just wing my crown insertions, and sometimes the bite would feel off or the floss was hard to get through. But I have a game plan for crown insertion, and this is half of the process of the crown. You've gotten this far, don't mess it up with the crown insertion. And what I make sure is that I push this crown on hard with my finger before I cement it on, and I'll kind of wiggle it on with my thumb. I'll have the patient bite down on a cotton roll, and then I'll check the floss. And the floss has to go through with a nice passive snap. If I can't get the floss through or I'm struggling to get the floss through, then I'll make my adjustments. And I'm not happy until I can get a nice passive snap with the floss. And then I'll go and check the bite. Sometimes when the patient bites on the articulating paper, it pushes the crown in a little more. So I go back and recheck with the floss to make sure that I have good passive snap. And then when I cement it on, I push it on and I have the patient bite on cotton hard. And I want to see that excess cement squeeze out. I'll clean it up again. I'll floss through, and then I'll have them bite down hard on the cotton roll. And again, some more cement may squeeze out, and that's when I know the crown is fully seated. And I hardly ever have an issue with the patient sitting up and saying that the contacts feel off or the bite feels off. But here's the new way. The new way is with the fast mill. And I just got it in July. And again, I can't believe I didn't have it sooner. Here's a case that a patient had an old porcelain fused to metal crown that was getting recurrent decay, and the porcelain fractured. I actually use a milled Bruxer now as my shade guide. It's just a great way to try to match the shade better. In fact, I have all the shades on a little necklace here, and I use that instead of the block of material or a Vita shade guide. I feel like this is just a more accurate way to take the shade. But this was a PFM crown. I sectioned through the porcelain with a diamond, my football diamond. I go through all the porcelain, and then I take a 245 and I go through the metal. I just feel like the diamond really works better with porcelain, and the 245 works better with the metal. And I go all the way through, and then I take a screwdriver-looking crown remover instrument, and I just twist and release the cement and get the crown off. And then I go through my workflow. I make sure I have good interproximal space where I can get my cord. Make sure I have good moisture control. I use a astringent for hemostasis, and then I scan. And here's my fast mill scan. This has just made doing crowns so much more fun. I feel like it's made me a better dentist. When you blow up these teeth, 20 or 30 times the size, it just makes you see your mistakes, and you can go back, and it's so easy to just look at your prep, trim it out, go back, re-prep, and then rescan. And I'll do this a few times. I'll sometimes do this 5 times until I'm happy with it. In fact, the first scan that I do is really just like a dress rehearsal. I go into it knowing that I'm going to do multiple scans with my fast scan. But once I'm happy, I send it over to the fast mill. I take my cords out. There's just so many great tools where you can use the curvature mode. I trace my own margins, and I enjoy doing this. I look forward to doing this. And I feel like who better to trace the margin than me, the dentist that was there prepping it, especially if it was a tricky margin or a deep margin. If I do have an assistant do it, I'll have them come and get me, and then I'll fine tune it before we go to design. I like to switch on and off from the color mode to the stone mode. And it's really there's just so many great tools. and then the design. And the AI is just, it makes it so easy. I'd say 95% of the time, the AI crown is pretty much the way I want it. This is my favorite part of the day. I could sit here and watch the crown being milled for all day. It's like my little zen. I'll go in my back lab and I'll just watch the crown, and it's like it's soothing to me. It looks like a little car wash in there, and I love the little green light. And if my staff can't find me, they know that I'm in the back lab. Let's see how I go to the next slide here. There we go. And then when it's done, it's like a little baby deer, zirconia deer that can run right after it's born. It's so awesome. Clean it up and it's ready to go. So super fun, super accurate. And it's just technology that I wish I had done earlier, but like I always say, better late than never. Is never too late to get started with new technology. And then there it is, cemented on, go through the cement protocol and cement it on. And I have a sandblaster that looks like this. I got it on Amazon. It's a pretty hefty duty sandblaster. So I always like to sandblast my Bruxer crowns first. Then I'll go through the whole protocol with IvoClean and a primer. And then I like to douse the tooth, especially if it's a vital tooth, with a few doses of microprime to try to decrease sensitivity. Now, the way I talk to patients, I like to talk to them like they're my 8-year-old son. I'm not going to say, sir, you have a fractured palatal cusp with a leaking amalgam and recurrent decay. They're not going to understand that. Instead, I'll say, you have an enormous broken silver filling on a tooth that you've had since you were 6 years old, and it's rotting. And they understand that. And that's the way I talk. I talk in lay terms. And this patient actually left the office and was going to book. I like to bust my partner's chops. He has not gotten on the same day crown train yet. He was going to book with my partner, and then he saw the sign I have outside that says same day crowns. He went right back into the office and rebooked with me, and he wanted a same day crown. He didn't want to deal with the temporary. And guess who else doesn't want to deal with a temporary? Me. I no longer deal with temporaries except for when I'm doing aesthetic cases or big cases. But again, here it is. I'll take the picture. I'll tell this patient, this is a tooth you've had since you were 6 years old. It fractured. It's got cracks. It's got a big filling. We got to do a crown on it. So I'll go through my whole crown protocol. Here's my round burr. Again, buccal and lingual. There was obviously less to do on the palatal on the buccal side because of the fracture. But I'll go through it and then I'll just sweep up and I'll have my buccal and lingual margins. And then I take my 245. I go through my interproximal slices, my occlusal depth cuts. And in this case, I ended up using the 245 to remove the entire amalgam. And then I finish the smoothing the interproximal walls with my fine diamond here. Again, I want to see gum in between. And if you can tell, I'm doing the same thing every time. It's a workflow, it's a game plan, it's a recipe. I'll pack my cord and then I'll finish up with the big diamond. I'll tell the patient they can leave. They can stay here. We have Wi-Fi. Go in the waiting room. I have 2 books of my own in the waiting room. I'm like, yeah, go to the waiting room and read one of my books. So they get impressed by that. Some patients go get a car wash. They go shopping. They go go for a walk. Other patients go in their car and they make phone calls. Some patients don't want to leave, so they just sit in the chair. But I always give them the option. Most patients end up leaving and come back, and we actually turn over the room and do something productive while the crown is being milled. And then I'm designing. It's so great with the digital technology to be able to trace your margin and check the occlusion. I used to really struggle with occlusion and occlusal clearance. When I was doing traditional impressions, I would try to look in the mirror and try to see, way back there for a number 15 if I had enough occlusal clearance, and it's hard. But when you do it with this digital technology and you need to adjust more, trim the scan, go back, re-prep, and rescan. You just do it until it's right. And I really feel like it's made me a better dentist. Here's a case that I did on my staff. I feel like your staff can be your biggest champion. I know a lot of people don't like to work on their staff, but this is a staff member that needed a number 14 crown. She was having symptoms with pain and with chewing and cold, big white filling with cracks. Prepped it using my stress-free protocol, cemented in. She loved it. Guess who's going to tell their patients how awesome our new technology is? She is. Guess who's going to come into my room when I'm trying to get treatment acceptance for a crown and try to push that patient who still has questions? She's going to come in. So treating your staff can really be such a great thing for getting case acceptance. And I'm locked and loaded. Here's my back lab. I got all my shades and different materials. So that's my little zen back there. So I've been doing implants for about 20 years. They used to be one of the most stressful procedures I did. Even with all my training, I would still be planning on 2D technology and freehand surgery. And sometimes they didn't go according to plan, and I would be sweating. I'd pray and hope that my osteotomy was in the right spot. Sometimes they weren't, and I'd have to go back and rechange my osteotomy. It can be stressful, but not anymore. Total game changer is guided surgery. I make my own guides. I make like a big, large pilot hole. So it's semi-guided, not fully guided. And I virtually plan my cases. Total game changer. I have a CBCT in my office. I'll scan the patient with the CBCT, my intraoral scanner, and then I'll virtually plan this case right in front of them. And they are wowed by this. They have never seen anything like this. I'll place the implant right in the bone, and I'll even put a virtual crown on there. And then I'll design my surgical guide. And most likely the patient is going to move forward and they're going to trust that you're the best person to do their implant because of all this great technology. But major game changer is I can see if this is a case that I want to do. If the bone is too thin or it's a case that I don't feel comfortable, I can see right away and I'll refer it to a colleague. And I'll just tell the patient, look, this is a little out of my comfort zone. I'm going to refer you to a colleague. And that's, maybe 4% of the time I'm doing most of the cases myself, but it's such a great way with the technology we have these days to not get involved with a case that you don't feel comfortable with. And implants are just a part of my general practice as anything else I do. I like to call it the tale of two blockies. So there's incision and flap blocky, and he does not want to upset suture blocky. So I want to make a nice clean incision and flap, and then I'll take my surgical guide and I'll prep right through it. I still am using an indicator pin, even though it's guided, because just want to make sure for peace of mind that I'm in the right trajectory, in the right position. I'll widen my osteotomy, and then I'll place the implant. Typically, I'll put a healing cap on right away if I have good primary stability. And then here you go. Suture blocky, super happy. Just a stitch on either side. Healing cap on, good to go. Usually wait about 4 months to let everything heal up. Another little tip is this magnetic bowl I have. I put all my drills and screwdrivers in that magnetic bowl during the surgery because I can't tell you how many times I've had a little part or piece roll off the table. So it's a great way. It just kind of sucks every little piece in there. And it's a great way for cleanup too. There's so many little parts where that something could easily get thrown out. So myself, I will put all the pieces in that little bowl to make sure everything's put together and nothing's thrown away. So after 4 months, I'll deschmutz the healing cap. There's usually some junk in there. Otherwise, trust me, I've been there. You try to put a screwdriver in there and it won't go in and engage, and then it could easily fall out. You just don't want to drop something in the patient's mouth. I'm typically doing I'm doing all digital. I don't do any more traditional impressions. It's all digital. And full zirconia, screw retained is my jam. I'll make sure, again, good snap with the floss. That's super important with screw retained. If you can't get the floss through, then most likely the crown is not seated all the way. And if you torque that in, you're going to have issues later on down the road. So it could be tedious, but you got to make sure you can get the floss through. You have to take the crown out, adjust it, put it back in. But once you do, I just fill it up with some Teflon and some composite, and there's no worry about cement or cement sepsis. And I always use a brand new screw, and I torque it down to manufacturer's recommendations a few times. Another game changer for me is wellness scans. For new patients, we have 90 minutes for new patient cleanings, and we've incorporated a wellness scan. And it's such a great way to show patients their teeth like they've never seen before, especially if you're doing clear liners. You can show them the crowding. These are my teeth. So here's my number 9 crown, the one that started it all, with the beer bottle. But we're adding this to our new patient workflows. And it's just such a great exam. The patient loves it. They're wowed by this technology. And I can do a better exam with wellness scans. It's hard to see in the mouth with just a mirror and the overhead light. And patients will start to pick out things themselves, like, oh, what's that silver filling? Or why are my teeth all worn down? Or what's this recession? Or what's this dark margin around this crown? And then it brings up the conversation for patients about, sleep and airway, night guards, crowns, fillings, bleaching. And guess what? If they want to move forward with treatment, you've already taken the scan. So that's why wellness scans are such a great game changer that we've added. Moving forward for 2024, like I said, I've broken free from insurance. We're now fully out of network, and I'm 20 years in, and I'm more excited than ever because of that. And like Roger Levine said, growing your collections and production 5%. I have no worry that that's going to happen because of going out of network. And I have no fear about it. I have no fear because we've done it strategically. I have great relationships with patients. Sure, some may leave, but most are going to stay. And we're just not stuck with playing that game with insurance. I'm going to get more involved with sleep and airway next year. So I've set goals for myself, and goals for production, goals for treatments. And it's just a great way to keep yourself re-energized. But here you go. Here's my Zen. I got a 3D printer. I got a fast mill going, and I'm working on a surgical guide. I mean, this is my jam. I love this stuff. It gets me more excited every day to go to work. And if you can find these game changers, then it's really such a great way to overcome burnout and re-energize yourself. I always like to end my speeches with this book. This is a book I read my 7-year-old son at the time. This was last year. It was about an egg that was putting too much pressure on himself, and his shell was cracking up. The doctor told him he's can't put too much pressure on himself. And I just love the fact that he's sitting on the doctor's table and he's got an IV of yolk. But oftentimes, dentists, we try to be perfect. We beat ourselves up when something doesn't go right. If we get a bad review, or if a case doesn't go according to plan. But remember, this is a marathon, not a sprint. Try to focus on the good things that happen and not the one bad thing that happened. Because guess who else has had problems, or not a great day, or a bad week, or a bad review, or a case that didn't go according to plan? Every other dentist in the history of dentistry. So this is a tough profession that we got into. It's a marathon, not a sprint. Don't beat yourself up. You're going to have good days. You're going to have bad days. I'm here for you if you need me. I've written some other books about my stress-free mantra. Stress-free dental implants is all about my career with implants. Stress-free entrepreneur is just about being an entrepreneur. It has nothing to do with dentistry. It's about going from that idea to actually pursuing a startup and taking that leap, and not fearing mistakes and failures. My first children's book is called My Leftover Dino Nuggets. That's a story that I wrote about my time during the quarantine, and kind of an inspirational story with my daughter. And then my next book, which is by far my best book, is going to be coming out in a week or two, called Stress-Free Next Level Dentistry. And that's all about how you go to that next level, to go from ordinary to extraordinary. So I wanted to thank you. It's such an honor to be a part of this. Anyone can reach me at eric@thestressfreedentist.com. You can go to my website, thestressfreedentist.com. If you're burnt out and you need some help, go visit the International Academy of Dental Life Coaches. We'll match you up with a life coach that understands dentistry, whether you're female, male, a hygienist, a dentist. We've got someone for you. And don't wait too long. I wish I had reached out for help a lot earlier in my career. But like I always say, better late than never. And I'm here I'm here if you need me. Any questions at all, you can put in the chat or email me at eric@thestressfreedentist.com. Thank you so much.
Thank you, Eric. That was a lot of great information. Thank you for sharing your very personal story, and I think it was meaningful to all of us. I think you definitely touched some points that so many of us have experienced. So thank you so much for that. We do have a bunch of questions that were put into the Q&A, so we've got a few minutes left. Let's go ahead and jump in there. You mentioned your plan for local anesthesia, and then you talked about the intraosseous injection. You specifically mentioned the Tuttle Numb Now, and I met Greg Tuttle a few weeks ago. But can you just go ahead and just tell them a little bit about the technique and where they can learn more? A lot of these questions are specific things that you showed them, and they just want to get a reference where they can learn more. So for the Tuttle Numb Now, how would they learn more about that?
Yeah, Dr. Gregory Tuttle, Tuttle Numb Now, TNN. I think you could just go to TuttleNumbNow.com or just Google search it and you'll find it. It's a technique, it's a protocol, and I'm just really big on having game plans and workflows. And what do I do if step one doesn't work out? Well, here we go to step two, step three, step four, and he has a whole protocol for anesthesia, and one of them is the intraosseous injection. He's got a whole technique that he teaches you. And like I said, there hasn't been a case that I can remember that I had to dismiss a patient because they couldn't get numb. And with my endo ice technique, I know they're very numb and they're not going to feel any pain, and they're not going to jump, like you're doing a number 19 crown prep and they jump and then you jump, and that's not a good feeling. And I no longer have those worries.
Yeah, I
So
mean,
it's
Eric, it's a great stress reducer to know that your patient is profoundly
yeah.
numb and they're not going to feel it. That's one of the best stress reducers you could ever have. Another question here about excavation of decay. Do you use any kind of caries indicator?
I do. Sometimes I do. If there's really deep decay, I'll use my Explorer or round burr, and but yes, I'll just use caries indicator if needed. There's no specific brand that I recommend, but I think they're all good. But yes, I do sometimes use it.
Great, great. You showed your really nice technique for back-to-back class 2 composites. Can you give a recommendation on the bands, the ring, the wedges, anything that people should be looking at, particular products?
Yeah, I've used them all. They're all good. V3 and Ultradent V3, Garrison, Paladent. They're all good. The key is the technique. I get the two bands in there, kind of back to back. I push the bands, down if it's, if they're bottom teeth or up, for upper teeth with my thumb, to make sure they're both in place. And then the key is getting a good wedge in there to hold the band stable. And then I just need one ring. And I've used all the the products out there, all the sectional matrix systems. They're all great. But the key is the ball burnishing. I'll burnish one side, I'll restore it. I don't take everything out like I used to, and then re-put the ring and the bands in. I'll cure it, and then I'll burnish the other side, go through my protocols of primer and bond, and then restore that side, and then I'll take everything out, final cure, and then all my final adjusting and shaping.
Great, great. Um, and I must have missed this, but did you mention some kind of sandblaster that you got on Amazon? Somebody asked about that. I didn't.
Yeah, it's awesome. It looks like, you're in some like lab, like working on like some virus with these gloves. It's like a professional sandblaster. I got it on Amazon. I can send anyone a picture of it, and it's an industrial size sandblaster. And you put your hands through these gloves, and it kind of seals it up so sand doesn't get all over the lab. And that's
What
been great. I
material
use
do you
it.
put in the sandblaster?
It's alumina. It's
Aluminum.
your standard sandblasting
Yeah,
material.
don't use the industrial sand, right?
Yeah, yeah, yeah. It's just yeah.
Very good, very good. Oh, and then that really cool magnetic ball. What a great hint that was. Where do we get that?
Amazon, baby. I just got that on Amazon, and I have a bunch of them. And I can't tell you how many times I've had a little, drill bit or driver roll off onto the floor, and it's just like, oh man. So now I just drop it in there, and it's great to collect everything and keep everything in one place.
Awesome, awesome. Um, okay, here's a good question because this is a source of stress sometimes. Do you offer any warranties on your work, your fillings, your crowns? Like what kind of a warranty do you tell your patients you offer?
Yeah, I do. It's case by case. Your standard is 2 years for a filling and 5 years for a crown. But look, if it's a good patient and they're taking care of their teeth and the porcelain broke, I'll redo it. It's good PR. The last thing I want to do is piss off a good patient, and have them repay. But sure, if a patient is not wearing their night guard, they're not taking care of their teeth, and we've warned them, and they're not coming for their recalls, then they're not going to get as much of a warranty as someone who's doing what they're supposed to be doing.
I think that's really good advice. The idea is that a dentist shouldn't drop dollars to pick up pennies. you know
Hmm.
that yeah, you've got a good patient and they're not happy about something, make it right. It's in your
Yep.
power to make it right. Go ahead and do that. I think that's great advice. And here is a magnificent question. And I hope we have with time to talk about this. How were you able to get rid of that PPO insurance and become an out of network practitioner? I think a lot of people would love to know that.
Yeah, this could be an 8 hour
Right.
lecture, and I wouldn't do it justice, but you have to do it with a plan. You have to do it strategically. Just after the quarantine, we started with some of our smaller PPOs like the Aetnas and the Guardians, and we successfully did it with them. Last year, we went out of network with Blue Cross, and that was 20% of our practice. And we did well with that. We made some mistakes and we learned from them. And this year was Delta, and that was 50% of our practice. So it was no easy decision. Most important thing is to have great relationships with your patients. Um, I've
Did you
explained to
talk to them
them.
about it months in advance to let them know this was your plan?
Yeah, I explained to them with emails, face-to-face conversations, videos. Patients still come with you with the question, why aren't you taking my insurance anymore? No matter how many times you tell them, you just got to keep at it and keep focusing on how awesome you are, how great care you give. This is the place to be. You're going to love our doctors. You're going to love our care. We have the best technology here. I try to steer them away from that focus on the insurance. And it's just building those relationships, getting great reviews. It's you got to do it strategically though, and start with your smallest PPOs and then build that confidence. But don't have fear. All your patients aren't going to leave. If you have good relationships, they're all not going to leave. Some will. Some that you don't think ever would leave will leave, and the ones that you thought would leave at the drop of a hat don't leave.
And the ones that
It's
you want to leave don't leave.
those are the ones that always stay. Yeah.
Right. No, I think really that's a great advice. In fact, somebody wrote in, can we get your lecture on leaving PPOs? And I think that would be a good thing to come back and talk about because, as you said, you started with your smallest one. You didn't do cold turkey. Hey, January 1st, I'm not going to take any of these plans anymore. No, and it sounds like it was a multi-year plan that you followed through with.
Yeah, and the staff's got to be on board. Everyone's got to be on board. Everyone's got to have the same message. And you just keep learning. You know, we were not very good at the verbiage in the beginning. We just got better and better at it. And now when a patient asks me, you know, why are you leaving our insurance? Why are you leaving our insurance? And I'm like, you know, you can still come here. You can still use your benefits. You can still use your annual maximum. We're going to still process all your claims. The big difference is you have to pay up front and then you'll get reimbursed. But I go back, but you're going to get the best quality care here. I show them the fast mill. I show them the printer. Like, just keep bringing that conversation back to the positives.
Excellent. Excellent. And our friend Dr. Courtney's got a great piece of advice here. The best stress reducer, don't be afraid not to treat some patients. And I think that's great advice. Dr. Eric Block, I think you shared a lot of good ideas, a lot of wisdom with us today. I really appreciate it. You know, it's like I always look at a lecture and go, you know, are people going to be better off after hearing this lecture? And I think in most cases, you've achieved that. So thank you very much for coming on and sharing your experiences. I think it was very, very helpful, and I really appreciate it. And thanks to the panel, and thanks everyone for joining us. And be sure to join us next week. We're going to have Dr. Miriam Cord, and she's going to be presenting on minimally invasive dentistry. So we'll have another good lecture, and we'll be back with our business advisory panel. So have a great week, everybody, and we'll see you next week. Take care.